Similar surrogate mothers, they get paid around $20,000, estimated to be 6 times more risky as living kidney donation, if that's allowable. And then there's all the ethical, moral, and operational issues, which you differentiate by socioeconomic status. The surveys done in Canada and also elsewhere in other jurisdictions don't demonstrate this, but whether this was actually occur when you operationalize it, it's unclear. It runs contrary to altruism. Well, I've explained to you why I think altruism misses a lot of the decision-making considerations. And there's other issues, commodification, perceptual issues. So there's moderate acceptance. Cost-effectiveness analysis suggests that it's worthwhile doing. I guess the question is, are these other legal and ethical barriers insurmountable that we should stop now, or perhaps we should proceed further? I also want to kind of point out that this is just one strategy out of many strategies. And one of the reasons why we're looking at it is that a lot of things have been done in Canada and other jurisdictions to increase donation. A lot of times a lot of money and resources are spent doing them, but it's unclear if they work. And so even if you have something that, yeah, it makes sense to pour lots of resources in to make it happen, if you pour those resources in and it doesn't happen, it remains a waste of money. John started off by asking about who's enrolled in a registry. From my cynical point of view, I'd say, well, what's the evidence that a registry works, number one? And number two, we're way behind. We don't even have a registry in Alberta. And some of you who are familiar with Bill 207 might recognize that that's one of the issues that it wants to address, but also perhaps to have a better organization for organ transplantation and donation in Alberta. So I'll leave it open for questions here. Hopefully there's some time to go through a few things.
John probably would like to go.
So I'll moderate the questions, because you might want to ask Lori some questions. I see we have one already right at the back there. Go ahead.
Yeah, so the number of people waiting for an organ of any kind in Canada is about 4,000. About 75% of those are waiting for a kidney transplant, by far the most common. Of total people on dialysis, you mean? Or sorry, I don't think I understand your question.
You said that 4,000 people are on the waiting list.
Correct.
How many transplants are done in a year?
About 1,300.
Okay, so we're talking about 30%. Okay, thank you.
Other questions? Go ahead, and then here.
Thanks very much, guys. Very balanced. Nice to see you both. Been running an intensive care doctor. Maybe I've got equipoise here, because I'm running an ICU right now with 2 patients who just received livers, 2 patients who need kidneys. Whenever these talks are given, it starts out with that there's a great deal of need for organs. There's a great deal of need for organs, and there is. I just don't really see the relevance of that point. My issue is I've got about 50, 60 organs right now in the ICU patients that I'm looking after. But presumably, you want me to save their lives first, not just jack up the numbers of organ donors. And when we look at Spain, it's commonly presented as a high-performing country. It's actually a very low-performing country when you look at what truly matters, their ability to save people from traumatic brain injury, which is the typical source of donation. So, for example, they often don't offer decompressive hemicraniectomies, a way we save a lot of people's lives. In terms of airbags, car safety, and all the things that are driving the numbers down, their performance is actually very poor. Now, I'm all for organ donation, but this isn't often stated. And I kind of feel like we're missing the connection between the two. If you look at Alberta, we're a very altruistic province in terms of tissue donation. But in terms of organ donation, our traumatic brain injury survival is very good, and so our numbers are going down. Presumably, we should be celebrating that point.
I totally agree with you, Peter. In the interest of time, I didn't take my slide out. We can confuse ourselves with the United States. Our end organ failure rates in Canada So for example, our rates of end-stage kidney disease are, for some populations, fully half of what they are. They're about 200 per million in Canada. They're well over 350, 400 million in the United States. So prevention is one big thing. Once you do a transplant, keeping the organs alive longer. So if you look at prevalent end-stage renal disease patients in Canada, for example, compared to the United States, so you take all people who are alive with needing some form of renal replacement therapy, we're higher in Canada than the United States. So it's not just about the organs, but clearly there's a shortage, there is a need for organ transplantation. Now that doesn't mean that you shouldn't, exactly what you said, we're not at all proposing that we should cut short our efforts to keep people alive so they don't progress to neurological brain death and become organ donors, obviously. But what I'm suggesting is we still cannot prevent people from going to neurological brain death, and we're not capturing all those people, but we're not giving those people the opportunity, in my opinion, to make a decision to donate organs. So I don't think we're on difference, but those points are important.
Can I just comment on that as well? I mean, John and I went out to Philadelphia where, and the issue was not trying to increase the number of donors. The question was, are we missing any donors? And they invested a huge amount of time, effort, and resources to identify where donors were missed and then identify strategies where that would be prevented in the future. So I guess the question remains is, how many donors are we missing? That's the critical question.
Just to flesh out the discussion, there are certain treatments that will save you and take you away from donating because you won't go on to neurological cancer.
And that's not, I don't think those should be considered as a missed donor.
But Peter, just to be controversial, you don't deny that every probably week in your ICU you withdraw care on individuals where care is futile, whether they meet a neurological diagnosis of brain death or not, and some of those individuals potentially could be organ donors.
Well, I work in a neuro ICU, and I've probably done more DCD cases than anyone there, so yes, I absolutely get it, but it's not, just for the rest of the audience, it's not quite as simple as everybody that dies could be an organ donor.
But it tells us, though, that as we celebrate the improved care of the neurologically injured patients, that means we need to capture those that do not get better. Even more, our efforts need to be even more stringent toward improving the organization of donation in Alberta. Yeah.
But the point is, certain treatments that aren't offered in the supposedly high-performing jurisdictions, we offer, and therefore we take people out of the donor pool. And then, okay, some people survive with poor function, but that should still be a celebration they survive. So.
Okay, thanks a lot. Always good points. Chris, over to you. We don't have a lot of time, so keep questions.
Okay, so really fascinating stuff. I think the biggest single signal of social preference in this area is the fact that a large number of people don't donate and don't sign up to donate. We may find that emotionally hard when we're looking at identifiable patients who we care for, but it might be that the most reliable data on social preferences for donation is actually the signing up or not to do it. And we might just need to get our heads around that and to look at recasting regulatory frameworks because we don't like the social preferences that we see is maybe a bit of a tail wagging the dog. None of the data that was put up there was actually convincing to me that there was a strong social preference for a different approach to organ donation. It was, yeah, if you want to offer some incentives, fine, I don't object to them, but actual evidence for social preferences, the strongest and truest revealed preference is the fact that lots of people don't sign up to donate their organs. I think we might need to just kind of get over it a bit. It's a bit controversial, I know.
Yeah, completely agree. And in fact, if you look at those surveys, it says that 30% of people will donate to someone anonymously on the list. Well, if that actually occurred, we wouldn't be having this discussion right now at all. So all these things, well, this is really preliminary. If we're going to pursue them, they need a lot more data, a lot more research.
More question here.
How do you see this examination of incentives for organ donation intersecting with the advent of 3D printing and stem cell research and companies, for example, like Organovo in the United States that have just announced that, you know, they've just produced a liver and they're going to be offered for sale in the future. How does that intersect with what we're talking about?
Well, I can even grab that one. Our team is very much involved in stem cell research, and we're actually part of the stem cell network here in Canada. Really exciting research, but we're looking decades, maybe even 50 years, 60 years before I think that's realized. I like to believe it's going to happen sooner, but if you look at how stem cell research has played out, I think those are realistic projections. Very, very promising, but we're not there yet. And it's money. Even with the 3D printing, I mean, and I'm sure that my colleagues will agree. Very, very exciting area, and we have stem cell researchers as part of our team. So we hope that these things will move forward together, and all the communities are increasingly trying to work together to make it happen. So I think, I know there are students in the audience that have to get to classes. I wish we had more time for discussion. I would like to say one thing about the law. Our research team, and I see a lot of them in the audience, are working on, I think Aaron might be here too, we're working on the very legal issues that were brought up. And the legal framework in Canada is really tough and we think a little bit outdated. As pointed out, if you read the legislation literally, virtually any kind of incentive is banned. So even paired organ donation, which is a form of incentive, would be banned. So we're advocating and moving towards, or at least trying to get a discussion about having a legislative framework that allows for innovation and some unique ideas to come forward. But with that, I'd like to thank the team for providing their unique ideas. I knew it was going to be fantastic. It's a real honor to work with these people. They're all good friends, and I'm looking forward to years of collaboration. And thank you so much for giving us your time.